My name is Zykeisha Law. I am currently 37 years old. I am a mother of two beautiful, active boys. They are 7 years apart, a 13-year-old and now a 7-year-old. I am a fire rescue dispatcher by occupation. Hobbies, I love traveling. I love reading. I rather read a good book than watch a movie. I just love to laugh. Like, if anybody always see me, I'm always smiling, and that's how I've always been. Even through pain, no matter what, I'm gonna smile. I'm gonna find a reason. That's just by it's habit, right? So, I started experiencing symptoms when I was like 2014 or 2013. I did not know initially that they were symptoms, right? I started having issues with anemia. So I had applied for the critical insurance that they're telling people to go get, the cancer insurance. And the insurance company actually dropped me, but kept my then husband and my youngest son. I received a letter in the mail that says that I was dropped off, and I was like, he has more health conditions than me. So how was I dropped off? I did not know that anemia is one of the things that insurance companies look for that is a sign of cancer being there. So that was one. We have to do a physical for my job. And I did my physical, and the physician called my mom and said, your daughter needs to go to the hospital. Her hemoglobin is super low. She could pass out. And I was like, okay, I didn't see much to it or whatever. I went later on that night, and they were like, as I had a migraine, the doctor actually did a very uncomfortable stool test right then and there in the room, beyond uncomfortable. And he was like, everything came back positive. They were checking me to see why why my hemoglobin was super low. It was not because of a cycle. It was not because of anything. So that was then. Nothing else was said or done about that. I was given a blood transfusion, and nothing else was done. I was told to go on bed rest for 2 weeks after the blood transfusion, and that's it. So moving forward, when I got pregnant with my son, my youngest son, it going through, doing everything, doing your regular test that they have you do at 6 months, the glucose test. And he called me and he said, your hemoglobin is really low. You need to see a hematologist. And I said, okay. And I called and I was like, hey, my hemoglobin is a 6 and I'm 6 months pregnant. And they were like, you're not coming here, honey. You're going to the hospital. I went, I was admitted, and they were like, something is taking your blood, but we don't know what it is. And we can't do tests to find out what extensive testing. So, they gave me the rundown on what happened with the baby, and so forth. And they were like, we're going to give you iron infusions. Fine. But every time they gave me iron infusions, my hemoglobin kept dropping back again. So they were like, something is going on. And before you have any major surgery, your hemoglobin have to be a certain number. Mine dropped right before my due date. And so at that point, I was, prior to then, they were trying to take him early. And I was like, nope, his birthday is this date and that's what it is. And so when it came down to it, the actual date, I said, well, what are y'all going to do? Y'all can't leave him in there. Have to take him. And they gave me all these antibiotics and things. Like, they were really concerned about doing major surgery with your hemoglobin being low. And so delivered the baby. Nothing else was said about the hemoglobin being low. Nothing. So when I came home, I started having excruciating back pain. And I was like, something is wrong with my back. And so I went to my primary doctor, who had me do x-rays. She was like, well, nothing's wrong with your back. It may be the epidural. Then my stomach was just really weird. Like, my stool had changed. It was really weird. Like, when I would eat, I felt like I had diarrhea, like, but it wasn't diarrhea. And so the doctor said, "You have irritable bowel syndrome," and gave me some pills for that. So I was like, okay. And I didn't know then about questioning the doctor more so. Then one day at work, I went to urinate. I was not on my cycle or anything. I turned around and it looked like a massacre was all over the toilet. Like blood was everywhere. So I took a picture of it, cleaned it up. I was at work and it was in the afternoon at that point. I went to my doctor and I said, "This is what happened when I was at work," and it was the only time that particular thing happened. And so she said, "Okay, maybe it's hemorrhoids, you know." And so it's always a maybe it's this, maybe it's that kind of thing. And mind you, for a whole year, I'm going to the doctor for the back pain, the stomach, with my babies in tow because I'm like, something is not right. Something is not right. And so, I said, well, maybe it's me. You start thinking like, maybe it's me. Is it in my head? Really? Am I really having this? Are these symptoms really weird? And so it wasn't until one morning that I was getting ready for work. I nursed my son as usual. I was still nursing. And after I nursed him, it was this really sharp pain under my right breast. And I was like, that's weird. And so I continued getting ready. And this is at 4 o'clock in the morning, 4 a.m. And I dropped him off as usual, went to work. I had to work a 16-hour shift that day. And I said, I was sitting there with my coworker and I said, I'm having this sharp pain. It was getting sharper. It was getting deeper. That pain was getting like really fast. And so her and I was sitting there going, think of things like maybe it's your appendix, maybe it's this, maybe it's that. Some people like maybe it's gas, maybe it was just a variation of maybe it's this. And so I said, I'm going to go to the urgent care on my lunch break and let them see what it is. And so I went, and the urgent care physician said they do not have the equipment there to do any testing. I need to go to the emergency room. That maybe I pulled a muscle or it's gallstones. At that point, I was like, I'm not going to the emergency room for a pulled muscle. Like, what if that's just what it is? I have to work a 16-hour shift. I'm just going to go back to work. And it was my supervisor who told me, she said, do not come back here without going to the emergency room first to see what is going on. And I was like, but what if it's a pulled muscle? She was like, if it's a pulled muscle, then at least it's a pulled muscle and in my mind, it's just, you don't think that it's anything huge. And so on my way to the ER, I prayed. I said, God, I've been praying that they don't find anything. But today, God, I'm asking you, let them find out what it is, because something is not right. And everything just lined up. They took me right in right away. I didn't have to wait. And they started giving me morphine. And because I couldn't lay down at this point. At this point, I could not lay flat. The pain was so bad. Like, I described it as a throbbing toothache in my stomach. That's exactly how I described it. They're like, well, what does it feel like? I said, I don't know. A throbbing toothache in my stomach. Let me just say that. And they did an ultrasound. And I did other tests. A lot of that was a blur, but I remember the ultrasound. And one of the techs came back and said, hey, have you been, have anything came back about your liver, about tests or different things? Have you been going to the doctor? And I was like, no. He said, He's like, we found a mass on your liver, but don't worry, it could be benign. So I said, okay. I never paid attention to what happened after them because they told me it was gallstones. They said, for sure it's your gallstones. We're going to remove your gallbladder in the morning. I was admitted to the hospital, but I never paid attention that I was admitted onto the oncology floor. It was someone who was close to me at the time. She said, do you know that they admitted you onto the oncology floor before they told you? They knew, they had a suspicion, and I did not know anything that whole night. But the next morning, right before surgery, the admitting physician walks in and says, "You have tumors and it's colon cancer." And he just said it. He just walked in and just said it. Like, I was like, whoa. No one was with me. And so it was hard to process something like that. Because in my mind, it was like, I didn't think cancer, that never came. And my thing is, I've been going to the doctor for a whole year. They never connected the actual dots. I was seeing the hematologist for the pregnancy related, but no one said anything afterwards. Because the thing was, they told me in the hospital, they said something is going on. We don't know what it is, and we can't do the testing. But no one said, after I delivered that baby, no one said, let's talk about what's been going on here. Let's talk about, you weren't supposed to have a C-section with your hemoglobin being that level. No one spoke on that. So it was really confusing. And this is not like the bash doctors or anything, because there are some phenomenal doctors out there. But I do tell doctors now, like, see about me as how you would want to be seen about, or how you want your loved one seen about. Or, I get the analogy like me being a dispatcher, that you may need, I don't see names, I don't see who we're helping, but I always try to go above and beyond, right? You don't know when you'll be on the other side of when you may need help. Like, no one expected this. This was so, I don't even think everybody didn't even know I was at the hospital for the gallbladder. And so people now knew that I was getting ready to have, the people that knew that I was getting ready to have the surgery. And so I cried enough. I had people that called me and I cried with them. At one point, I was comforting people like, it's going to be okay. It's going to be okay. Because all I could think about were my babies. I said, why are you taking me from my babies and you just gave them to me? And that's all I could think about. I was like, it was a death sentence. It was a death sentence for sure. It's something that I wouldn't wish on anyone to receive. Even if it's expected, it still hurts to hear it. It still hurts. Like, at that point, they did a colonoscopy, and they said based on the scans that it was for sure colon cancer, but they could not tell me the stage. I had to go see a specialist afterwards, and I did not go right into surgery. I had to then first I met the first oncologist I had. I've only had two. The first one I had, he was just really like facts and evidence. Every question you ask him, facts and evidence says this, and facts and evidence says that. And so he got to the point where he was not reachable. He was unreachable. And so my insurance, I didn't know, did not cover me getting treatment at the hospital that I was at. I would have had to change. And that was the best change. God was all in the math for that, because the oncologist that I have today, in remission, he's still my doctor. He's just a phenomenal person, and he cares about, I always feel like he cared about my life, and he does. And so he ordered right away. I started chemotherapy, where I had to get 12 rounds of chemotherapy, of aggressive chemo. And so aggressive chemo was something that I was not prepared for. The first oncologist told me, you're going to still be able to go to the gym. You're going to be able to run around after the kids. You're going to be able to do all these things. And so I was like, okay. And doing research, okay, people do these things while going through treatment. That I had to do, first they were going to do 6 rounds of chemo and then surgery, but we ended up doing the full 12. And so, I'm sorry, correction. We did, I want to say 8. And then I went back in for the last 4 afterwards. Right before, so with colon cancer, or my treatment, one of the drugs I had was Avastin. And Avastin, so I started off with 12 rounds of chemo. And I'm sorry, let me go back. Before I even did all the chemo, I had a cruise already booked for my son and I. my sons and I. And so it was a birthday cruise for my oldest. I went on that cruise, came back, started treatment. The same day that I came back, I had to go to get my port placed in that morning that I came back. And went and had my port placed in, and I said, this is it. And I actually have a video. I found a video the other day that I didn't know I recorded of my sister taking the bandage off of my port. And I was like, I'm going to keep this in for 1 year. This is it. We're going to be done with this thing. And so treatment was not what I expected. Nothing could have prepared me for what happened. I was so sick. So treatment was hard. It was depressing. I'm not going to lie. I dealt with depression in a different way. Like, I'll always show up and smile like nothing was wrong. But this was different. That I had to sit in it. I couldn't be around people. This is before COVID. I was wearing masks before COVID. I was wearing gloves before COVID. And, to get the stares, like, why you have a mask? Or my kids, them having to be careful around me. Them go to daycare and school. But now I have to watch out. And so chemo was 46 hours total. And I had to get the Neupogen shot after that. I didn't know what Neupogen was. So after a few rounds of my white blood cell count going down, they're like, hey, we're going to get this Neupogen shot. And it's going to bring your cell count up. I'm like, okay, let's go. Oh my God. That shot is traumatizing. I'm traumatized to this day from what it does. The bone pain is not like mild bone pain. It feels like it started always at my neck, like this heated rush. And then it felt like something was breaking my bones, going down my body, just breaking. And it's paralyzing pain. Like, I felt like I couldn't move, I couldn't touch anything, just scream. It was, when I switched to University of Miami, that's where I met the surgeon that I had to deal with. And he, before I even started treatment, this was the conversation. He said my liver was covered in masses, like most of my liver. Only a small portion of it was clear, but majority of it was covered. And so I knew that I would have to end up getting surgery. He told me that he considered it because of my age. If I was older, he would not recommend something like this. The liver is a huge surgery. I didn't know how huge it was because it's bloody, it's all the above. And so I did about 8 rounds of chemo, and then it was time to go into surgery. 2 weeks after I did chemo, they withheld the Avastin, but I did the other chemo, the Folfox at first, and then I went to Folfuri, but Folfox. So I went, I didn't even recover good enough and went straight to this huge surgery. And I didn't know to even speak up for myself or like say, hey, wait a minute, is that a lot? Like what we're doing? And the conversation when you're dealing, I didn't know like what the cancer world is, we're trying to save your life, so we're going to do this, and this, and you gotta deal. And so I went into surgery. They put me to sleep really fast. They were like, we gotta get her out. And so I woke up from the surgery, and I wasn't sent to the ICU. I was sent to just a regular room. I was gonna be admitted. They were like, hey, the surgery went fine. Instead of moving, the conversation was to remove 60% of my liver. The surgeon said he removed 70 instead. So he removed 70% of my liver. So that was the first time that I was diagnosed. I was diagnosed 3 times. That was the first. And mind you, this was in the era where colon cancer in a young woman was not, it was not the norm. This was in 2017. Now you're starting to hear more about colon cancer in younger people. But at that point, so when I went back to my primary, where all this started, he was so nervous. They were like, we would have never suspected this in a young fertile woman. I immediately became a case where people were just curious. Like, wait a minute, you had stage 4 colon cancer? And think about it, like when they did the timeline, I had it when I was pregnant and didn't know it. That was the cancer. So after that, I was told, hooray, you're in remission. After the surgery, I had to go back and go in for what they call the cleanup chemo, just to make sure that there was no residual, right? And they were like, hooray, hooray, you are in remission. They didn't expect, I did not know that they didn't, I didn't know how serious colon cancer is, right? Um, there are other cancers that may be stage 4 or 3, but they're curable. But colon cancer is one that is the second deadliest cancer. So it may not have been curable. I did not know that at that time. So they were like, I was like, man, they're so surprised that I made it. Like, but they were like, you're in, my oncologist said, you're in remission. This is good news. This is celebration time. So I did what I love. I went on a cruise. Went on a 3-day cruise to celebrate. I was like, I'm still here. Yes. After the cruise, I was like, you know what? Let me live life a little. Um, Took my kids to go see snow and in Baltimore. And so, I'm living life, but at the same time I was having this pain. I was having this pain on my right side. And when I went to said surgeon to say I'm in pain, he said to me, I should not be having pain still. The surgery was a success, is what he told me. And he went on to say, like joke, like maybe because you don't want to go back to work, like that type of joke. And I was like, I was really annoyed because I said, I actually like my job. If I'm having pain, I'm having pain. But my mom is like a doctor without the degree. So she she researched everything. She gonna look like she's like a doctor without the degree. So she would go with me to these appointments. So when he said that, she said, how about we do a scan to find out why they're still paying? How about let's do that? Like, this is my mom saying this, right? And I said, yeah, let's do a scan. Let's find out what's going on. So we did this scan. This scan sat on his desk for about a good, was it almost a month or so? Or maybe a longer. When I come back, I start getting all these phone calls. Why is the hospital calling me? And so they're calling me back to back. The nurse says, hey, something showed up on the scan that you did back in December. Now we're in January. Something showed up on the scan that we're actually towards the middle end part of January. She said something showed up on the scan you did back in December. And the surgeon wants you to go see your oncologist. So I go to the appointment. Before I go to the appointment, I went on the app to see my results. I said, why are they calling me? What is going on? Look, oh, nodule that was located in the right lung back in August has now grown. I said, what? So now I'm looking up about nodule. Oh, it could be, it could be pneumonia. It could be this, it could be that. So I cited with it could be pneumonia. Why? On top of that, I had just left the ER after that scan. After the scan in August, after the scan in December, I went to the ER and they told me I had pneumonia. The nurse practitioner confirmed it wasn't pneumonia. It was indeed cancer. And now I was confused because I said I just left the emergency room. And they didn't say anything. They was like, well, maybe they figured you already knew. Huh? Like, like, like this can't be it. So this surgeon did not speak to me. He did not deliver the news. I went to my oncologist. He was very caring, phenomenal. And he said the first words out of his mouth was, I hate that you have to start the year off like this. So immediately I went to see my oncologist, let's just say on a Tuesday. He already had chemo scheduled for me to start in 3 days or so. And so now the plan is, so now they had to do a PET scan to see where all the cancer was at. It was in my lung and it came back in my liver. So mind you, I just had surgery on my liver. So now the concern is, if we cut any more of her liver, like there were so many concerns. So then the oncologist said, okay, what we're going to do is before chemo, we're going to do the surgery. We're going to have the lung surgeon go in and remove that nodule. He said the only way, he said to get cancer out is to get it out. So let's go there first. But right before the surgery, this is how you know when your doctor is really thinking about you and really concerned. Right before then, he calls and he says, you know what? I thought about it all night. I looked at your scans all night. I think it's best to do chemo. Let chemo get as much out of it as it can, and then we'll do the surgery. Well, this time I knew what chemo was going to be like, right? I knew what to expect. I knew the biggest part was the Neupogen shots. And so I was told by my oncologist, isn't meant to knock you down because we're trying to get the cancer out. And so that chemo took away the cancer that was in my liver. And so they just had to remove the nodule from my lung. And it was then that my oncologist told me, as far as a prognosis, it was 15%, but it goes down every time you're diagnosed. So a prognosis of me making it through that. And so that was a very humbling moment because I got these kids, right? I got small babies and it takes a lot on you. It takes a toll. And so I did that, went into remission. I rung the bell. I had a whole party.
1, 2.
For ringing the bell, like bling, bling, bling. And I was good. And I went back to work and my friend of mine, her husband had passed away from colon cancer, from stage 3. And so I got to the point that I took a break from cancer completely. Now it wasn't no big timeline. I just made in my mind, I was like, I'm not going no scans. I'm not doing nothing. I just don't want no more news. I'm done with cancer. And, she told me, she was like, you're going to your scans. You're going to those scans. And so she made me go do the scan. I went to go get the results. This was the same week COVID happened, but this was a few days before the world shut down from COVID. Went to the doctor and we're just talking. We're like, I'm good. And the doctor's like, there's an area of concern. And I literally broke because it was that week that, the things happened between my ex-husband and I that I was hurt. And then the cancer. And then I was like, what is going on trying to co-parent all these things? And so I broke down. I think that was the biggest shock of my life. I just did not expect it. And this time I had to, it was more than just, it was going right back to chemo again. I was diagnosed, I'll never forget this, on a Thursday, and Tuesday I had to start chemo. Like he already had it planned out for me before I even got there. He's such a phenomenal oncologist. I really thank God for him. I said, I'm just tired. I at this point, Alexis, I was tired. I was tired of life. I was tired. I just didn't know what to do, how it just no. Went to chemo, started off, and I was showed to chemo with my graphic t-shirts, light up shoes on, makeup, the head wraps, and this time he changed it to full furry. He said, you have such, he said, I don't want the burns in your hands. I don't want all these things. I'm going to do full furry with you this time. It was that chemo that took out my hair. The pain, the bone pain is crazy. Also, chemo brain, right? I had a lot of chemo in a short period of time. It wasn't spaced out. It was almost 4 years back to back. So chemo brain and people not getting it because people look at you and say, there's nothing wrong with you. You're good, you're together, but there's so much inside, as well as my teeth. My teeth is a big thing for me now. I had braces when I first started chemo, and I was told by the orthodontist and dentist that I would be fine. And I probably would have been fine for just that one time, right? But I had it a second and third time, and I still went to them, and they were like, everything was going to be fine. So when they got ready to take the braces off, the enamel for my teeth started coming off with it. And little by little, my teeth just kept decaying, and my dentist told me it was going to continue because at this point, the chemo had rotted out my teeth. And when he showed an x-ray from me being there just 1 year before until that time, it looked completely and I had just had all this dental work done. So dental is a big thing of it. So there's a lot in the mental and emotional. I can honestly say I went into a deep, deep, dark place that this can take you to, because you feel like at one point I feel like I was trapped and could not get out. I had he's a phenomenal surgeon. I love him. He's so honest. Did 4 major surgeries at one time. One was a full hysterectomy, because I was told that in women the cancer tends to hide in her uterus. So they did 4 major surgeries at one time, and I spent about 10 days in the hospital. That was the minimum that they required. I don't have a colostomy bag. They did not remove my entire colon. They removed 34 lymph nodes from my stomach, a lymph node near my left kidney, the full hysterectomy, my gallbladder. I think that's it. I think that's it. They would have kept me longer, but at this point, mind you, it's during COVID, so my heart go out to people who have to be in there longer. And so I did that, and my last treatment was April 2021. I am relieved. I know remission is I start to see remission differently. Because remission is like this waiting period. They're waiting for something to happen. Because, they're big on, after 5 years, I'll celebrate with you. I had he's a phenomenal surgeon. I love him. He's so honest. He even said, after 5 years, I'll celebrate with you. But right now, this is not it. Even when I was told that removing part of my colon, I always say, be your own advocate for your health. Ask the question. Do not feel scared to ask questions. Do not feel scared to even try things for yourself. You have to be at peace with your own decision at the end of the day, because some people are anti-chemo, some people are for it. Some people are like, hey, they went and grew a garden, and that's how the cancer went away. Whatever way it is, you just have to make sure that you have to be at peace with every part of it. So I would just say, don't just take the first answer that's given. Go research some more, ask the questions, and research some more. And so, and just one more thing, I was for me, my faith was a huge part of it. So mental and emotional, the way you go into this is huge. So I always smile, and I was told by a lot of nurses and doctors that because I smiled through it all, that's the reason why I made it. And I'm not saying everybody have to smile. That's not my thing. I'm just saying whatever gives you peace while going through something like this, find that and protect that.